Hi, my name is Anoet Mohoza. I'm going to present the project more about approaches to healthcare careers. That the project contains different topics. The first thing I will talk about healthcare, which is available in our industry. I will also explain the difference between non-clinical healthcare job and education, and also the skills non-clinical healthcare job that people can require to have in order to complete their task. The second, I will explain allied healthcare profession. The next, I will provide the examples of allied health professional, and also I will explain more about registered nurse and the licensed practical registered. Starting with healthcare careers available in our industry. We have different career options like physicians, which is doctors, nurses, dentists, medical assistants, healthcare administrators, and the cancer. Cancer is the someone who will be in touch with the patient in order to help them to don't give up, have hope, with their optimism, also thinking positively when they are suffering different disease. Those are the options we have in our industry, and you have the people to apply and the competitor to that job. For example, the physician we want are the people, or the nurse are the people who interacting with patients hand in hand every day, meeting with them while you are consulting, while you are taking tests or exam with any disease of any illness that patient has. And also medical assistants help the patient to meet with doctors, are the one who plan their appointment, give them the specific day and the time he or she can meet with doctors. Also the healthcare administrators is the one who is responsible to organize or to manage all activities at the hospital, in order to achieve their goal or have successful or provide quality care to the patient. Moving to the three different examples of non-clinical healthcare job. First we have medical assistants. The medical assistants are the people who work with doctors to help them in different activities. When a patient needs a doctor first, he or she can meet with assistant before meet with doctors, because the assistants are the one who provide them the appointment, who know when doctors are free, when doctors are available at the hospital in order to connect the patient and the doctors. The second, assistant will have different skills, like should be able to blood pressure, assisting doctors in examining room, and also performing simple lab tests. Those are the skills medical assistants should have in order to perform well at the workplace. Again, also they can learn those skills when he or she is already in the job. Maybe she or he can attend a different training or workshop at the job in order to improve that skill. Also medical assistant should have associate degree that can be received in 2 years at a community college or in any college. That degree can help her or him to perform well or to complete all assigned tasks on time, and also can perform well. The second non-clinical healthcare job is medical secretaries. are the people who manage information move within medical office, just within any business office. They are the different skills which is necessary or which is required to have when you are secretary in given hospital or clinic. Some of the skills are office software skill, knowing medical terminology. Back to the soft skill, I like to know more about technologies, because secretary are the one who are writing different reports to their boss, or different activity or different action done at the hospital or at the clinic. Reason why that person can be able to have that skills, soft skills, technology skills, knowing how to typing, Microsoft Word, Microsoft Excel, and the other skills. Also, it's important to know medical terminology, because in different industries they have the terminology they use. The terminology healthcare industry use are different with other terminologies like accounting or other industry or other business. That person can be able to know that terminology, because when they are writing the report, you cannot use any word you want, but you can use terminology or the word which is related to healthcare. They can learn the skill on the job in training or particular course, can take another particular course online, or also attend the class in order to improve the skill. The training is obtainable in institute and the community college. The last one, medical secretaries can have the certificate or any associate degree from qualified school, from any specific school. Moving to the next. Next is healthcare administrators. Is a group of range of tasks. Healthcare administrators have many tasks to complete in hospital or in any healthcare industry. He or she is in charge of financial management, to know the money company receives, the money company use outside. Also, the staff coordination can also organize or coordinate all employees in that industry. Also, she is responsible to project planning, like to know the next step that industry will do, the next project that industry have in order to improve or to expand their industry. And also is in charge of policy and the process application. Is like to set policies which every employer or patient who needs services in that industry can follow. Moving to the skills that those people are required to have in order to perform well in their task. The skills someone to be health administrator are financial skills, business organization, law and ethics. Those are the skills necessary or that person should have in order to perform well or to achieve their goal in that industry. Moving to the degree, that person should have a master's degree in healthcare administration. Here are different with other non-clinical job. We saw here is like a master's degree in healthcare administrators. That is meaning when you have bachelor's or associate, you cannot perform well in that job. Means you cannot get that job. It is better to have master's degree in healthcare administration. Moving to other slides. We have also allied health professionals. Yeah, allied health professionals are the group of health professionals who use scientific values and evidence-based practice for analysis, evaluation or assessment, and treatment of acute and chronic disease. It is also encourage or motivate disease prevention and awareness for best health, also being aware or being healthier without any illness or without suffering any disease, and they apply direction and management skills to support healthcare arrangement in a variety of settings. There we have examples of allied health professionals. I have medical technology, I have dental hygiene, I have physician assistant, I have health administration, I have health information management, and also emergency medical sciences. Yeah, those allied are working hand in hand with nurses, with physicians, dentists, and people who provide the medication to the patient. Yeah, they provide complete patient-centered care and being the expert in practice, nutrition, health education, and speech. Yeah, they are expert in those different because they work the hand in hand with professionals, doctors, and the other experts in healthcare. Next slide is about registered nurse. Yeah, registered nurse, I found that is the backbone of healthcare provision in the United States. The registered nurse provides critical healthcare to the public wherever it's necessary or it's needed. Yeah, moving to their responsibility. Yeah, the registered nurse, it requires to physical exam and health test before making serious decisions. Also deliver health promotion, counseling, and education. The next, manage medication and other personalized involvement. The last, responsible is organized care in teamwork or in group work with wide collection of healthcare specialists. Moving to the licensed practical nurse. Yeah, licensed practical nurse, also known as licensed vocational nurse before, yeah, is supporting the core healthcare team and work under supervision of APRN. APRN is like advanced practical registered nurse. Again, it is in charge of knowing the whole healthcare journey of patient, to know if the patient go to ask any support at the hospital. Yeah, they are responsible to know when they started, like the first consultation or the first test in lab until the end of that patient. If it's like being well, if it gets good medical who is related to his or her illness, things like that, to know how the doctors help that patient when he started until the end. Yeah, it has also different responsibility. Check sign which mention the condition of person health, like heartbeat and body temperature, that health is deteriorating or improving. The next, do basic nursing purposes such as changing bandages and wound dressing. The next, make sure patients are comfortable, healthier, and rated. Next one is, may administer medicine in some settings. Yeah, that are different responsibility of licensed practical nurse. Yeah, thank you so much for watching this video about Project Explain different things about healthcare and